Hello, my name is Daisy Hughley and I'll be your nurse practitioner today. What's your name?
Michaela Bernard.
Okay, and what's your date of birth?
March 5th, 2002.
Okay, well it's a pleasure to see you today. Do you have any concerns that I should be aware of before we get started?
Nope.
Okay, good to go. Well, I'm going to take a moment to clean my hands and then discuss what we're going to be doing today. Today I'm going to be providing an assessment of your abdominal area and your nervous system. That's going to involve some touching, some tapping, some listening with my stethoscope, and some touching with some sharp and dull objects. So I'll be asking you several points of instruction, and I just ask that you follow along with me. Is that okay?
Yep.
And do I have your permission to touch?
Yes.
Thank you. Well, just to get started, can you tell me a little bit more just about your abdomen? Specifically, when was your last bowel movement?
Today.
Okay. And then roughly, when was your last menstrual cycle?
About last month.
Okay, thank you. Well, what I'm going to do is go ahead and have you lay down. Typically, we raise your shirt and look at your belly, but we're not going to do that today for the purposes of this exercise. But I'm going to ask that you put your arms beside you, and I'm just going to take a look. And if your shirt was raised, what I'd say is I don't see any bulging, any scars, any rash, and everything looks pretty normal there. So no active concerns there. And then I'm going to move to our next phase of assessment. And that is going to just be looking at how your stomach's moving up and down. I don't see any bulges. I don't see any peristalsis. And I'm going to take a second now and listen and just verify what it is that I'm seeing. So just breathe normally, and I'm just listening to your bowel sounds right now. Thank you. I'm hearing healthy, normal bowel sounds. And now what I'm going to do is really listen to a couple of different places, because when I listen to your abdomen, I can also listen to your renal and the aortic. And so I'm going to take a second and listen to a couple of different spaces. First, listening here to the aorta, and I can hear the blood circulating here. I'm going to listen over here to the kidney area. And again over here. Everything sounds normal and within normal limits. And I'm going to take a quick note over here. I'm also going to, usually in these cases, listen to what we call our femoral arteries, and those are right here. But just for the purposes of privacy, right now I'm not going to pull your pants down to listen to those femoral arteries. So now I'm going to take a moment though and feel around your belly, okay? So I'm going to put my hands on and just feel. Is there any pain as I do this? So I'm not noticing any bulges, any hernias, or anything like that as I feel. Just going to take a quick note. And now I'm going to do what they call kind of a percuss, and that's that tapping thing that I had discussed earlier. So just bear with me as I percuss on your abdomen. And everything sounds perfectly normal as it should there. And I'm going to be doing a different kind of touching on your abdomen now. We're going to do just a little bit of light touch and some deep touch. And I just want you to let me know if anything that I'm doing hurts. Okay. Everything feels normal as I touch. I'm going to push just a little bit deeper, okay? Okay, no concerns there. Everything seems to be within normal limits. And now I'm going to assess for what they call some peritoneal inflammation. So I'm going to have to do a couple things. And one of the things is what we call some rebound tenderness. So I'm going to press deep and then release. And I just want you to let me know if it hurts, okay? So I'm going to do a really deep press. Okay, good. Thank you so much. Next, I'm going to test what they call a Murphy's sign. And so Murphy's sign is when we have you just take a deep breath, and I'm going to push as you take a deep breath, okay? So take a deep breath in. Okay, release. one more time for me. And one more time. There you go. Good job. Thank you so much. And so we're going to do 3 tests that really are related to your appendix. I don't think we have any concerns about that right now, but we're still going to do some quick assessments for that. We're going to do kind of feel around this right lower quadrant area. Yeah. Okay, still no pain there as I feel? Okay, good. So now this might get just a little bit awkward as we do some feeling. I'm going to have you uncross your legs for me. And I just want you to just push up against my hand. All the way up as high as you can go. Just keep that leg straight. Not with the bending, and keep the leg straight and push up. Okay, any pain as you do that? No. Okay, good to go. Now I'm going to come around. And I'm going to bend your leg this time, okay? And the same thing, I just want you to let me know if there's any pain. So relax your leg. I'm going to bend it. Any pain as I bend? How about if I turn out that way? No pain. Perfect. Thank you. Now then, moving on, we're just going to test that cutaneous hypersensitivity. And so that just bear with me as I just feel one more time around this area. And no pain with that either. Okay, thank you so much. So now there's some other areas of your abdomen I'm going to feel. I'm going to take some time to percuss, so again tap, and palpate your liver. Okay, so that's going to be up here. So first I'm going to percuss, okay, so I'm going to listen and tap. Okay, let me just feel around here too. Any pain as I feel there? Thank you. Again, within normal limits. And now I want you to go ahead and, actually I think I can do this laying down. I'm going to do the same thing around your spleen area, okay? So I'm going to be feeling. And then again, percussing. No pain there? Okay. Go ahead and sit up for me, please, as I take a second to look at your kidneys. And so again, what I'm going to do first is just feel, and then I'm going to do some deep pressure. Okay, no pain as I just feel? No. Okay, so then I'm just going to do kind of a knocking on your, any pain as I do that? Any pain on that side? Okay, thank you so much. And what that does is it helps me assess for what we call CVA tenderness, and you didn't have any of that there. Now, I want you to go ahead and lay down one more time for me. And what I'm going to do is palpate the width of your aorta. So again, I'm going to have my hands on and be feeling down your belly. Okay, everything feels within normal limits and no concerns. Okay, thank you. Go ahead and have a seat up, and we're going to move on to what we call our mental status exam. So first, if I can ask you, what is today's date?
March 12th, 2024.
Okay, and where are you right now?
Virginia, Woodbridge, Virginia.
Okay, thank you. Who's the president?
Joe Biden.
Okay, thank you very much. Okay, and then as we move on, we're going to do a couple of tests to just really get a good look at your cranial nerves. There's 12 cranial nerves, and I'm going to be running through a couple of things to kind of get an assessment of all 12 of those, okay? So now, what I'd like to start with, I do not have a flashlight, so I'm going to be using my cell phone, so bear with me as I use my cell phone to use throughout this process too. But to get started, can you close one nostril for me? And just close your eyes. Take a sniff. Okay, and what would you smell?
An orange.
Okay, can you close the other nostril? Take a sniff. Okay, and what did you smell there?
An orange.
Okay, perfect. Still seeing bilateral smells on both sides. And I want to take a second and to just look into your eyes, and this is again where I'm going to have to use a flashlight. Pretend like this is a different kind of flashlight. So just look place straight ahead. Just look at my nose right there. Good, pupil refractory. Turn off the flashlight there for a moment. There we go. Please continue to look straight at my nose. Okay, now I want you to go ahead and follow the light. Okay, another side. Okay, thank you. We're going to continue just to look around at your eyes. I want you to go ahead and follow my finger, okay? I'm going to go in. Thank you. And then I want you to tell me when you can see my fingers on the side.
I can see them.
Thank you so much. I'm not seeing any eyelid drooping. I'm seeing good movement. Can you blink a couple times for me? Okay, thank you. And good blinking. Now I want you to really just first tighten and clench your jaw as tight as you can for me. Okay. And release. And can you give me a smile? Thank you. And you can relax. Both looking good there. We're going to do something what we call just kind of assessing for a sharp and dull sensation. This is just a little fork, kind of a crochet pin here. And if I can see your hand, this is going to be our sharp sensation, and this will be our dull sensation. Can you feel the difference between those? Sharp and dull. Okay, so can you close your eyes for me? Lift your head. You can put your hand down. And I just want you to tell me if it was sharp or if it was dull.
Dull.
Okay. Dull. This isn't the most sharp thing. Let's change our plan. If it's like this, it's dull, sharp. If it's like this, it's dull. Okay. Sharp, dull. All right. Let's try this again. Ready? Close your eyes.
Dull.
The pen is sharp.
I'm so sorry.
Okay.
Dull.
Okay.
Sharp. Dull. Sharp. Sharp. Dull. Dull. Go. Sharp. Sharp.
Okay, thank you so much. I don't have the sharpest tools there, so I apologize for that. Now what we're going to do is, well, typically we do what we call corneal reflex, but we're not going to do that today. That's really just testing to see how well your eyes would water. Kind of strip up a piece of gauze and tickle your eyes and see them watering. But for the purposes of tonight, we don't want to irritate them, and I don't want to take you to urgent care. So we're not going to do that exercise. So we'll slip on to the next one. What I want you to do, I've already seen you kind of smile, but can you give me a frown? Deep frown? Deeper. There we go. Get it close. Deep frown. There we go. Close enough. Raise your eyebrows up. Okay, and down. Can you turn your head to this side? And nope.
No. Just
twist your whole head to look. Perfect. Twist your whole head this way to look. Perfect. Thank you so much. Looking good there as well. What I would like you to do now is just to plug one ear for me. And I'm going to whisper something into this ear. And you tell me what I whispered, okay?
1, 2, 3.
Perfect. Plug the other ear.
A, B, C.
Perfect. Thank you so much with that. Now, I just want you to take a second to swallow for me. Okay. Any trouble when you swallowed?
No.
I hear you talking to me. Is there any hoarseness or trouble as you're speaking?
No.
Okay, perfect. Thank you so much. Now I want you to take a second and just shrug your shoulders for me. Perfect. Now I want you to do that again as I press down. One more time. Thank you so much. Okay, moving on. We're going to test, I want you to just, for one thing, I'm going to grab my flashlight one more time. And can you say ah for me? Open your mouth and say ah. Stick up your tongue just a little bit. Okay. Looks like you had a tonsillectomy. Okay. Thank you so much for that. Okay, so now what I'd like to do is just kind of test your motor strength just a little bit. So I'm going to put some resistance on you, and I want you to push against that resistance, okay? Just like we did with your shoulder.
Okay.
So if you can raise your arms up like this, can you, I'm going to pull. Can you pull the gets? Perfect. I'm going to push. Oh, thank you so much. Okay, you can relax your arms. And now I'm going to do the same thing kind of with your hands. Can you just push up? Okay, and again. Thank you. With your legs, can you raise them up? Good job. Okay, can you push up? Thank you so much. And then again, I'm going to do the same thing kind of with your head here. Twist it, just your head, not your whole body. Thank you. And right here. Thank you so much. Any struggles with that movement? Okay. So I want you to just kind of show me just your coordination a little bit. Can you take your hands and touch each of your fingers to your thumb? Perfect, thank you. Can you take one finger, right or left, and touch my finger? Again. Other hand. Okay, now I want you to do the same thing one more time. Okay, now close your eyes, put your hands down, and touch my finger again. Good job. Can we open your eyes? Touch it right here. Okay, hands down, close your eyes and touch my finger again. Thank you, perfect, good job there. Now again, now what I'd like to see is you take a moment and I just want to look at how you stand, okay? So if you could stand up straight for me. Thank you so much. I just want you to stand there just relaxed. And what I'm doing is just observing how steady your gait is, meaning just how steady your stance is. I don't see any wobbling, I don't see any shaking. You have good balance there. And I'm observing it for about 15 to 30 seconds just as you stand still right there. Now, what we are going to do as well is have you close your eyes and do the same thing. And just continue to stand as I observe. And again, I'm not seeing any concern there as you stand. Okay, what I'd like to see you do now is just walk for me. If you could walk just normally to that wall. Thank you, very steady gait. Stop right there. If you can walk heel to toe back here. Thank you. Now I want you to turn around and this time, could you walk on your tiptoes all the way back to that wall? Good job. And now can you walk on your heels back to me right here? Perfect. Thank you so much. I see no concerns with your gait. What I'd like you now to do is to come right here, kind of in the middle again. So just so we can get a good view in the camera. And then what I'd like you to do is just hop on one foot. So raise one leg up and go ahead and give me a good hop. Thank you. Can I see you do the same on the other foot? Thank you. Now what I'd like you to do is kind of a 1 foot squat. Do you know what I mean? When you have one leg up, squat down, and just like that. Okay. And down and up. Good. Now can you do the other leg for me as well? And down and up. Perfect. Thank you so much. My next thing, last one for this series, I'm just going to move my camera a little bit over because I feel like I'm getting cut out there just a little bit. There we go. Can you hold your hands out straight and just stand still? And now can you close your eyes? And again, very steady. I'm not seeing any shaking. It's looking quite well. Perfect, and thank you. You can open your eyes and relax your arms. Now, I want you to take a second. There's one step that I did forget to do. If you can sit down for me one more time. And just from where you are, can you read this bottom line right here of letters?
LTFZHCD.
Perfect. Thank you so much. That wraps up that neurological assessment of your eyes that I was doing earlier. So thank you so much for doing that. Right now, I want to take a second and just kind of test some of your sensory stuff. If I had a tuning fork, I would test vibrations by like tapping the fork and then running it up your abdomen and seeing when you stop feeling those vibrations. I don't have a tuning fork, so we won't be doing that exercise today. However, there's some other things that we can do today. So I want you first to go ahead and close your eyes and hold out your hands. I'm going to put some things in your hands and I just want you to tell me what they are. First item. Chapstick? Yes, perfect. Thank you so much. I'm going to put 2 more items in your hand. This is the second item.
A pen or marker?
Perfect. It is a marker. And then the very last item I'm going to put in your hand.
A ring.
Yes, thank you so much. Perfect there. You may open your eyes now. So now I want you to tell me if you feel kind of 2 points versus 1 point. So this will be 2 points. This will be 1. 2, 1. Okay, so hold both hands out. Close your eyes.
2, 1, 1, 2, 2, 1, 2, 1, 2, 1, 1, 2, 1, 2, 2.
Thank you so much. Now, what I'd like you to do is I'm going to touch as your eyes are closed. I'm going to touch down your arms, and I want you just to tell me if I'm touching one side or both sides, okay?
1, both, both, 1, 1, both,
Okay.
both.
Okay, thank you so much for that. And so now going on, I want you to, I'm going to do the same dull and sharp thing that we've done before, but this time I'm going to do it on your arms. So, well, are you able to kind of feel this is dull, this is sharp? Go ahead and roll up your sleeves just a little bit for me. We'll do it through the pants leg. So I want you to close your eyes one more time.
Dull, sharp, dull, sharp, 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 dull, sharp, dull, sharp, 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 dull, sharp, dull, sharp, dull, dull, sharp, sharp, dull, sharp, sharp, dull.
Thank you. You can open your eyes now. Since I have our fork out, I'm also going to just test some of the reflexes on your foot just with this, and I just want to see if you feel the,
Yes.
yep, and it curls up
Yes.
quite nicely there in your foot. So we're going to test some other reflexes while we're at it, and I got tangled just for a second there. I'm going to use my stethoscope to do a little bit of tapping, okay? I'm going to tap on your inner elbow and then again on your outer, and then I'm also going to be tapping on your knees and then on the Achilles tendon area, okay? So just kind of relax your arm. Okay. We're going to get inner. Let me see this wrist. Just relax your arm for me. I'm seeing good reflex there. And again. Okay, thank you. I'm going to be tapping, trying to get a good angle for the camera, but right here on the knees. That was a good reflex there. Very good kick on that one knee. So, and again, right here on your Achilles tendon area. Okay, and the other tendons. And we're getting very good reflexes in all of those areas. So now, just like we've done before, I want to do just a little bit of light touch on your abdomen, just to assess kind of those nerves in your abdomen. So you can lay down one more time for me. And again, this is our fork here.
Mm-hmm.
I'm just going to do, can you feel that going up?
Mm-hmm.
Okay, great. Thank you so much. Well, it looks like we have tested all of your sensory system. We've done our deep tendon reflexes. We've done light touch, hard touch, and we've also assessed all those cranial nerves and your abdominal system. I see no concerns right now. Is there any concerns that you have for me?
No.
Okay, well, thank you so much for participating today. I greatly appreciate it.